Head and neck cancer. Introduction. What is the name of a tumor that invades other organs and body parts? Choose one of the following options. 1. Malignant tumor. 2. Cancer. 3. Metastatic cancer. 4. All of the above. Correct. 85% of head and neck cancers are linked to tobacco use. Select true or false. Correct. The most important risk factors for head and neck cancers are tobacco and alcohol use. A biopsy is the only sure way to know if a person has head and neck cancer. Select true or false. Correct. A pathologist studies the tissue under a microscope to look for cancer cells and confirm the diagnosis of head and neck cancer. Stage 1 cancer is more dangerous and advanced than Stage 4. Select true or false. Correct. Stage 1 cancer is less advanced than Stage 4. This means it is usually more treatable. Treatment for head and neck cancer depends on the location of the tumor, the stage of the cancer, and the person's age and general health. Select true or false. Correct. Talk to your healthcare provider about treatment options and the side effects associated with them. Thank you for using Explain.